Welcome everybody to the Filipino Nursing Diaspora Day webinar on navigating change, the educational and cultural transition experiences of migrant Filipino nurses, brought to you by the World Communication Alliance. My name is Samantha. I work with the WCEA and I'll help you with any technical difficulties you may have in the chat. And for those joining us for the first time, WCEA is a social impact technology organization dedicated to using digital tools to help healthcare professionals grow their skills, improve care, and support healthier communities worldwide. If you have any questions for our speakers today, you can use the Q&A section and we'll address them towards the end of the presentation. Now, I would like to hand over the mic to Miss Irene Mayo for her opening remarks. Over to you, Irene.
Thank you so much, Sam. Hello, everybody around the world, particularly in the Philippines. Can I just see on the webinar chat where our participants are coming from? Just like to know. I myself am from Sydney. It's so good to see almost 100 of us here, and we look forward to this presentation. Now, I wanted to just also welcome very much a good friend of mine, Dr. Glenn Ford Valdez, who will be our speaker for today. Essentially, it's great to see how across the world, Filipino nurses continue to embody resilience, adaptability, and a strong sense of purpose as we navigate language, different cultures, and of course, new health systems. The journeys of our migrant Filipino nurses reflect both courage and complexity. We have to balance professional excellence with the challenge of belonging in unfamiliar spaces. Dr. Valdez's work captures this experience with depth and compassion, and through his research and leadership, he has explored how education, technology, and cultural understanding can support nurses in making these transitions smoother and more empowering. His research reminds us that change is not just something to endure, it's also an opportunity for growth, innovation, and connection. So, as we listen to Dr. Valdez today, we will celebrate the stories of Filipino nurses, the stories of learning, adapting, as well as transformation. And we acknowledge their valuable contributions to global healthcare. So, welcome. We are honored to have you, Dr. Valdez, as you share your important work about migrant Filipino nurses. Thank you.
Thank you so much, Irene.
Thank you so much. Before we begin, I would just like to also play a message from Dr. Violeta Lopez. One second, and then we'll hand it over. One moment. Okay, you can see my screen, correct?
Yes.
Thank you, Irene.
Good day to all of you, and warm welcome to this important webinar hosted by the Filipino Nursing Diaspora Network. Today, we are honored to feature Dr. Glenn Ford Valdez, a respected nursing scholar and educator from Sharjah University, Kingdom of Saudi Arabia, whose voice and vision reflect the growing leadership of Filipino nurses in the Middle East. His presentation will deepen our understanding of the realities and opportunities facing nurses in transnational settings, an area that lies at the heart of our advocacy. This webinar is a celebration of partnership, purpose, and progress. On behalf of the FiND Network, I extend heartfelt thanks to our collaborators, St. Anthony's College, the Pacific Nursing Service Organization, and World Continuing Education Alliance for standing with us in empowering nurses across borders. May today's session spark reflection, connection, and shared action. Today, let us continue to shape a global nursing community that values equity, excellence, and Filipino leadership. Maraming salamat, and may this time be a fruitful learning experience for all of you and for us. On behalf of the Filipino Nursing Diaspora Network Directors and Advisory Board, enjoy today's webinar and learn from it. Thank you very much.
Wonderful. Thank you so much. Now I would like to hand it over to you, Dr. Glenn.
Thank you so much, Amanda. So let me share my slides. Is it visible to everyone?
Yes, we can see it.
Okay, thank you so much.
Perfect.
So thank you so much for this opportunity to be with you this morning or whatever time it is in your place. I would like to extend my thanks, of course, to WCEA and Nursing Diaspora Network for allowing me to use this platform to share the recent results of my research study entitled Navigating Change, Educational Cultural Transition Experiences of Migrant Filipino Nurses. So the basic understanding of how Filipino work in different countries is a little bit overshadowed by many things. So things that are not really known to many of us, especially those who are planning to go abroad. This particular presentation for today will try to identify the experiences in real life settings. I'll be reading some transcripts that are relevant to the study proper, and also will try to identify what other areas that needs to be seen as something that we need to prepare to when we plan to work abroad. This particular objective of this study is primarily to, of course, not only motivate our nurses from the Philippines to work abroad, but also to see the reality or the reality of life of being a OFW or a migrant worker for that sense or that matter. I think my presentation is backwards. So moving on. So navigating journey of the migrant Filipino nurses, this presentation will deal with the educational cultural transition experienced by migrant Filipino nurses with the global demand for skilled nursing professional. This exploration study illuminates the challenges that is encountered by adapting to foreign healthcare system and the complexities of integration to diverse workplace environment. The objective of this particular research that I've conducted this year was aimed to analyze the socio-educational acculturation experiences of Filipino nurse migrants in various international healthcare settings. It investigates the emotional, professional challenges they face and examines how these difficulties influence their adaptation and integration to the new environment. This particular study followed a specific research method, which is a qualitative phenomenological design. This qualitative phenomenological research design allowed an in-depth exploration of the lived experiences of nurse migrants. This method facilitated the understanding of the unique challenges and adaptation in various international work contexts. In this particular study, I've utilized Colysis 7 method steps in extracting the information from data collection, familiarization of data, initial coding, identifying the themes, reviewing the themes, extracting the themes, defining them, and naming the narratives, and of course, writing the initial findings. Colysis 7-step analysis method was instrumental in extracting and elucidating the participants' experiences, ensuring that their voices were accurately captured and the themes were grounded in their narratives. A remote structured interview was conducted among Filipino nurses. The inclusion criteria was The nurses should be a Filipino by origin. Nurses should have worked in the clinical setting or practice and have been deployed at least less than or not more than 36 months. The structured interview touched on the different nurses from several countries such as Saudi Arabia, Oman, United States, Finland, Australia, and Germany. The initial sample was about 35 respondents, but it was narrowed down to 10 based on the inclusion criteria. The ages of the participants is about from 30 to 40 years old. Most of them work in the bedside, a few of them work in critical care units, and some work in the rural health units. Thematic analysis was done to reveal the key themes of the study. So that is done through the interview narratives that really reveal the themes and highlighted the emotional, educational, cultural challenges faced by the participants during their migration experiences. There were 7 key findings that were identified in the study, so we'll try to discuss and give you the exact narratives of our respondents related to this particular key findings. The first of the 7 key findings would be emotional and cultural dimensions. Participants reported navigating complex emotional landscape characterized by feelings of guilt and isolations and challenges in negotiating their professional identities grounded in their cultural values. The participants primarily experienced guilt and isolation and dissonance and personal identity loss. For many Filipino nurses, emotional transition into their host country is a significant professional one. Participants often describe the feeling of guilt in leaving their families behind, especially when primarily they are known as their primary breadwinners, or some of the parents leaving their young children. One of the participants from Finland when mentioned that they are not guilty or feel bad of escaping the Philippines. They need to or they have to. This sentiment captures the tension between Filipinos' ambitions or the personal ambition and familial responsibilities. Nurses also shared the sense of cultural dissonance in the new environment. They often struggle to feel seen in the healthcare system abroad. Some describe subtle stereotyping or lack of appreciation for their qualifications and experience. A US nurse recalled, I came here with full confidence, but here I had to work all alone with no mentors or no support. Despite the challenges, many highlighted how their Filipino values, particularly resilience, adaptability, and compassion, helped them integrate. However, it was clear that the emotional toll was just higher than the workload, but also cumulative in pressure. So the fear, or of course the feelings and emotion of being up far from home and operating in unfamiliar system and negotiating professional worth is something that they have to deal to in this particular instance. The second emerging theme, of course, this is very common, would be language and communication barriers. Language barriers significantly impacted the communication with nurses, facing difficulties in code switching and cultural deference, affecting their professional interaction with the patient care. The language and cultural communication can sometimes become a hindrance to proper patient care and, of course, communication with the healthcare teams. Tagalog English code switching and cultural deference and language barriers are very imminent or prevalent among the participants. The interview revealed how language is not only a practical barrier but also an emotional cultural anchor. Nurses often intersperse Tagalog with English, which highlighted their internal negotiation between the world they came from and the one that they are adapting to. The words or Tagalog words such as yung, kasi, or nga frequently appeared even in the English-dominated responses while doing the interview, showing the continued influence of Filipino thought patterns and expression. Participants also noted how cultural deference, respect for authority, and hierarchy can sometimes clash with more egalitarian or assertive cultures of their host countries. For example, a nurse said that there in the Philippines, we respect our managers and colleagues in different ways. Here, it's more direct and it took time for me to get used to it. Moreover, some nurses felt that their ability to communicate professionally was underestimated due to accents, struggle with the host country language. This was especially pronounced in countries like Germany and Finland, where the nurses were required to learn new language entirely. One particular note about the German nurse or the nurse that is working in Germany is that the German exam is conducted entirely in German, even the practical part, adding another layer of stress on top of their clinical responsibilities. The third emerging theme would be systemic barriers, which comprise of credential recognition, issues in rigorous licensing examinations, leading to bureaucratic stress and delayed employment. Across all the countries, the participant countries, the transition into the licensure recognition and qualification emerged as a dominant challenge among the participants. Many nurses had to undergo additional training like language proficiency exams, adapt to new system of documentation of care, and so on. For an instant, a participant in Germany had to pass rigorous combination of written, oral, practical exams in German language to be officially recognized. She mentioned, you work with the patient the whole day under observation. She said describing the clinical part of the test is rigorous and tedious since it is given in German language, not in English. In Saudi Arabia and Oman, the tedious and lengthy verification process, such as undergoing MUMARIS, which is a significant application that processes the licensure of nurses in the Kingdom of Saudi Arabia, and undergoing data flow for verification or verification of documents were seen as something that is prolonging the employment. This bureaucratic overload and the system of processing can become a source of burnout even before the participants or the nurses get employed. Another emerging themes would be differences in the quality care and clinical practice gaps. The participant highlighted notable gaps in clinical practice standards and patient ethics, often observing discrepancies between the Philippines and their host countries' healthcare practices. So patient safety, hygiene, and comparative standards are the topmost narration or the verbalization of the participants. Many nurses compared the quality of healthcare delivery in the Philippines to that of their host countries. Interestingly, these comparisons were not always in favor of the latter. Nurses often emphasize that Filipinos are trained in higher regard for patient care and hygiene, and sometimes exceeding the standards found abroad. One nurse in Oman stated, even though we are not fully recognized, Filipinos still preferred because we are known to be hygienic and thorough. Others describe adjusting to the environment where specific procedures or standards seems to be more relaxed or culturally influenced, sometimes creating ethical dilemmas. Next would be the emerging themes on motivation and resilience. So as Filipino nurses, we are known for our resilience and grit. Family and financial motivations were significant drivers for migration, with participants demonstrating resilience as they navigate through the challenges of their new environment. The underpinning theme on overall powerful narrative of the nurses from all the countries that are interviewed were the presence of resilience, o pagtsatsaga, or how they cope up with their new environment. For nearly all the participants, economic stability and family welfare were primary drivers of migration. Many entered nursing not just as a career, but a vehicle for mobility. One participant verbalized, I wanted to give my family a better life. I wanted to give my parents a decent house, shared by one participant from Oman. The journey often starts with uncertainty and struggles, usually with volunteer, unpaid internship and training in the Philippines and limited resources, but is fueled by the clear vision of a better future for them and for their family. So even faced with systemic barriers, they found ways to adapt and evolve and flourish and carry their Filipino identity with pride rather than limitation. We move on to the educational transition experiences. Participants face educational transition challenges, including navigating bridging programs, adapting to different teaching styles and learning environments. Filipino nurses consistently emphasize that their nursing education in the Philippines, our education there in the Philippines, was rigorous, holistic, and hands-on. However, upon migrating, many discovered that their qualifications were not immediately recognized in the host countries. This mismatch has led to the requirement of bridging programs, re-education, or taking another additional licensure exam on top of the local board examination, regardless of how long their experiences. One participant in Finland mentioned that she has to undergo 1.5 year of bridging course to meet the local standard. The participant noted, "We are trained well in the Philippines, but the laws and protocols here are different. The care planning here is simpler, but the language is the biggest hurdle." Another participant from Germany: "Nurses were required to learn German language up to B2 level. This is the acceptable language level for them to work in the clinical area, and then undergo the intensive exam. They call it Kinesiprüfung. This type of exam helps them to be evaluated, or they are evaluated theoretically, practically, and observed with direct patient care. And all of these are done in German language, not in English. In Australia, one participant who lacked clinical experience in the Philippines had to repeat the entire nursing course, with, of course, accelerated program for some credited subjects that were taken during her BSN program. This process often felt frustrating and redundant among the participants, especially for nurses with substantial clinical experience. Most of the nurse participants in this interview, they had, I think, at least 7 to 10 experience before they move into their host country. So it was quite frustrating on their part that their qualifications and years of experience were not really credited when they move into the specific countries. This process often felt frustrating and redundant, especially for nurses with substantial clinical experience. So the Philippine educational system was technically sound, but the language, legal frameworks, documentation standards were totally different, necessitating retraining. A change in the pedagogical shift or the philosophical shift in the education training system from rote to reflective was also noted among the participants. The participant described the shape of teaching styles and learning environments when transitioning to foreign education system. In the Philippines, education was often described as rigid, hierarchical, and punitive. This is how they describe the Philippine education system. If you commit a mistake, you get punished for it, or you receive something in order to learn from it as a mistake, with instructors instilling discipline through fear and failure. A participant from Finland mentioned, "In the Philippines, we were afraid of making mistakes because we might be yelled or scolded. Here in Finland, they encourage learning through trial and error. You are not punished for failing, you are coached." This contrast was echoed in Germany and Australia, where participants appreciated the student-centered, supportive, and less authoritarian learning environment. The fear-based motivation commonly associated with the Philippine nursing schools has shifted abroad into a more reflective developmental model, the one that emphasizes on critical thinking, peer collaboration, and holistic assessment. A part of the educational transition experience is, of course, the use of language. So language has become a barrier and a gatekeeper in order for them to be properly educated. Language emerged as both literal and symbolic challenge in the educational transition of the participants. Participants noted struggles in medical jargon, slangs, accent. Even in English-speaking countries like the United States and Australia, there were struggles in terms of the accents in the regional settings or the settings where they are placed. In Germany, one participant said that I had to start from an A1 level German in order to progress to B2 in order to work. It's like coming back or going back to first grade or kindergarten and learning ABCs again. In the United States, Even fluent English speakers struggle with regional dialects. The southern accent eats up consonants. The participant mentioned, I could understand the words, but not the rhythm. Language wasn't always about communication, it was a measure of competence and confidence. In several cases, nurses delayed licensure or struggled with exams simply because language complexity is on the way or because the lack of knowledge of the language. So they cannot simply take the examination, just in the case of Germany, they cannot take the exam because it would be given in German language. If they don't learn the language, they will not be able to pass the exam and of course take the exam. Licensing credentialing bureaucracy overload can also be identified as one of the prominent sub-themes in the educational transitional experience. Near universal frustration on the bureaucratic burdens of credential recognition was also identified. In Saudi Arabia and Oman, it involves data flow, mumaris, or prometric exam systems in order to be qualified to work as a nurse in the bedside. One participant in the Kingdom of Saudi Arabia said that it took me almost 4 months to just process my data flow and eligibility for Prometric, and you have to still take the interview and fulfill ministry requirements. In contrast, in the US and Australia, smoother and less, but still expensive and time-consuming pathways that involves the NCLEX, IELTS, and other requirements for visa were there. The cost of education as a part of the transition experience was also very prominent in the interviews. Education abroad were described as financially draining but necessary. So those several participants had to work while studying and take out loans to rely on support networks to complete programs. So in this particular country, despite being a foreign trained nurse, foreign education is seen as an investment, such as going for further studies like masters or specialty programs. The next emergent theme would be that of cultural adaptation. So cultural adaptation is seen as something really challenging on the part of the nurses. Cultural adaptation involves adjusting to the new workplace and social integration challenges and experiences that shocked most of the participants, and some discrimination were prevalent. Many participants described experiencing culture shock when entering the healthcare systems that operated differently from what they are used to in the Philippines. In the Philippine hospital, often the hierarchical structure is present. So from top to bottom. So usually the authority or the lower rank members of the hospital or institution are complied to follow the orders and expected to follow the decision of the senior staff without further discussion. In contrast, in workplaces such as in Finland, Australia, and the United States, they found itself more collaborative in the environments that are dealt with. As a junior staff, they are encouraged to speak up, contribute to care plans, and challenge the decision if the patient's safety is at stake. One participant mentioned, in the Philippines, we were used to following orders. Here in Finland, the doctor asks you what you think. And at first, I didn't know how to respond. It felt awkward. So it's a little bit awkward on the part of the nurses since they were used to just following orders and not questioning anything about the doctor's order. Language as a cultural adaptation tool is also something that is mainly the participants struggled with. So understanding the tone, the humor, and the nuance of the language can be a little bit difficult. Although language proficiency exams such as IELTS, a B2 German language level is given or passed by the participants, they still found that there's a challenge in the everyday lay communication, including understanding local humor or sarcasms, interpreting tone or verbal cues, and navigating patients' conversation or emotional disclosure. In Germany and Finland, nurses struggled not only on the vocabulary, but also cultural nuances of politeness and patient assertiveness. Stop humor didn't translate well in most of them in the beginning. So one verbalizes that in Germany, patient calls you directly by your first name or even challenge your decision. It took a little while to realize that that is normal and not disrespectful. Exclusion and emotional exhaustion can also be seen among the participants. Several participants mentioned and verbalized about feeling stereotyped or underestimated, especially in their institution. This phenomenon has been present mostly in Middle Eastern countries, European countries, and some Northern American countries. Common issues included being assumed to have lower qualifications, that they are not qualified for the job since they have to take a revalidation or they have to take a bridging program or integration program. Receiving less critical prestigious assignments. So the worst assignment in the clinical areas are usually given to the migrant nurses. So those that are likely not um, very prestigious, such as those that involves direct bedside care or hygiene care, were really given or aligned or given or passed through the nurses, even if it's not necessary. Being talked over team meetings that they don't have the right to talk because they are from a certain country and so on, has already been there as a part of the verbalization. Perceived as just a nurse versus a skilled practitioners. So there's a big connotation that nurses or Filipino nurses are kind and polite, that they just smile because you are a Filipino and they think they can just push you aside. This is one of the verbalization of the nurses from the Middle East. Patient expectation and cultural values can also be something that is very challenging on the part of the nurse. The patient-nurse dynamic is something that is aligned with the level of language, of course, the cultural uh, orientation and the ability of the nurse to really immerse themselves in the culture. So this was a challenging area, as a part of the cultural adaptation. They are more involved in their care plans. The patients are more involved in the care plans, likely to express concerns or reject procedures, and protected by substantial legal rights. The shift in the communication strategy, especially the use of consent, privacy, and autonomy, was new for most of the nurses, since these are most likely practiced in the Philippines, but not that as much supported in terms of rights and laws. In Australia, I was surprised how much patient has to say about their condition and how they should be treated. You cannot just clean a wound, for example, without explaining everything and getting the full consent. This is even something that is new for the nurses, and this is done even in something minor. So this is important that the nurses also verbalize in this. Religious and social norm adaptation was also very commonly experienced by the nurses. Nurses in the Middle East, for example, faces a different kind of cultural transition, adapting to Islamic values, gender segregation in hospitals, and prayer-based scheduling. Female nurses are noted to have to adjust into the expectations of modesty, interaction with the male patient, and of course, cultural etiquette. Meanwhile, in more secular countries such as Finland and Germany, it has been difficult for some nurses to feel their spirituality because they feel that they are isolated and struggled with finding communities or churches that help them to feel grounded. Social integration and social belonging is also one of the sub-themes under cultural adaptation. Many nurses feels that they live a dual life. So being professionally integrated but socially isolated. This was especially true in rural, non-diverse areas and small towns in Germany and the United States. Some of the participants were employed or deployed in areas where there were no or none to zero Filipinos in the area, so they have to fend for themselves in terms of building their own community. So the persistent sense of otherness and isolation, especially during Philippine holidays like Christmas, New Year, or important family events where family food and humor reminded them that they are far away from home. So those are the different 7 teams or the 7 teams and sub-teams that are a part of the study process. Let us now look into and delve into the more further discussion about how Filipino nurses navigate these emotional cultural challenges. So Filipinos known to be resilient and Filipinos nurses migrating from various countries often grapple with feelings of guilt for leaving the loved ones and isolation in the new environment. They face significant challenges in negotiating their professional identities as caregivers, and it has taken them to experience some emotional toll of separation from their families. However, the resilient and adaptability of nurses focuses on deep-rooted values such as that of pakikisama, bayanihan, and so on. This powers the nurses to overcome adversities and integrate into the diverse healthcare settings. As mentioned earlier, a further discussion of the language and communication barriers were quite challenging on the part of the nurses. 75% of them says that there's a difficulty in code switching, that is translating from Tagalog to English or Tagalog to Finnish or German. This was very evident among them during their transition period. 60% of the participants experience challenges in the accent. So even those that are placed in English-speaking countries, nurses have difficulties in, of course, understanding some of the English language because of the rhythm, the tone, the nuances of the language. 70% of the participants noted the cultural difference sometimes conflicted with direct communication styles. So this is the hierarchical process of communication in the hospital, where in the Philippines they are more used to not talking really to higher position individuals in the healthcare setting, whereas when they are placed in Western countries, they have to be very interactive and be able to share a piece of their opinion, especially if the safety of the patient is at stake. 50% of them faces significant obstacles in varying language proficiency levels that affected their confidence and interaction in work. One of the important verbalizations that were taken during the interview was that in countries like in Scandinavian countries, specifically Finland and of course in Germany, the nurses in the clinical practice or in the wards where they work, where they are co-workers, if ever they need something, they need to really talk in the language, which is either Finnish or Swedish or German. Even if the nurses knows how to speak in English, they will not talk to you in English simply because they want to train you and they want you to adapt. This made the transition process really brutal on the part of some of the nurses. Challenges and of course recognition and supportive frameworks and licensing. We mentioned that earlier, dealing with the many requirements or the prolonged process for the nurses to be able to be qualified to work at the bedside. So nurses needs to undergo a bridging program that will be 1.5 years in some cases. Some of them needs to submit all their documents and papers to undergo a rigorous process of validation and revalidation. This becomes a very tedious process that frustrates the nurses and becomes very stressed even before they join the workplace. Supportive framework for licensing in the Philippines and from the agencies deploying the nurses were zero to none in some cases. After being deployed, there is no additional support for them. So this causes a lot of problems in the transition into the roles that are given when they are deployed into their respective countries. There were apparent quality care and clinical practice gaps. So, owing to the practices in the Philippines where things might not be very ideal, but of course that depends on which institution you came from. Filipino nurses consistently reported that clinical practice standards in host countries often diverge significantly from those in the Philippines, leading to challenges in patient care delivery. Participants highlighted that their training in the Philippines placed strong emphasis on hygiene protocols through patient assessment, which often found lacking in the new environment. This is true in some countries where hygiene is not really a priority on the care of the patient. So most participants says that even if they want to perform hygiene measures to the patient, it's not part of the culture and work practice. This becomes a dilemma on their part. Ethical dilemmas in patient care arises when the participant felt that the expectations surrounding the patient care were not uniformly addressed or upheld in different healthcare system. So similar to most of the healthcare system, there are also variation and differences on how the care is provided or given to the patient. So this was also one thing that they verbalized. And of course, cultural commitment to care, despite the challenges in language, culture, and so on, the nurses in this particular situation are still able to provide the care that is merited by the patients by giving meticulous care practices that help them to advocate and improve the care practices and standard in the workplaces that they are assigned to. The family motivations of nurses primarily deals with, of course, the reality that most nurses move into specific work placement abroad because of the financial reward. Most nurses said that their salaries would be at least three, at least five times higher compared to that of what they're earning in the Philippines. The primary motive and motivator is that largely Filipino nurses are considered breadwinners with familiar responsibilities. This economic drive for improvement and the resilience of the Filipinos in moving into another countries in order to provide a better future for their families is something that has driven them to the point on which they are able to uh, adjust and transition to the differences and the difficulties in the countries they are placed. The values such as bayanihan, utang na loob, pakikisama are very well ingrained among the Filipino nurses, and this has strongly influenced their resilience so for them to keep going on in their country of assignments. The study findings identify the four different phases, which is very common among the nurses. The nurses at the initial would be deployed in the areas where they are able to meet the challenges and recognitions about their qualification and revalidation process of their qualifications, such as their licenses or, for example, their educational background. They then undergo through the rigorous bridging programs. In some countries, it is 1.5 years. Some countries, you have to repeat the entire BSN course, with some courses credited accordingly to your transcript coming from the Philippines. Next would be the shift in philosophical learning. Filipinos experience significant philosophical shift in learning environment from moving from the rigid hierarchical educational practices to a more reflective centered approaches. This was mentioned by our participant when they said that the education system in the Philippines is more of a punishment system. You create a mistake and you get punished, while in the countries, those nurses that are participating in this study or participated in this study, they've seen that the teaching strategies are more of a trial and error, and mentoring and coaching is an important part of the learning process. Then finally, they undergo the integration into the clinical practice. Not all the participant has fully integrated into the clinical practice. Some are still adjusting, specifically those that have to really learn a new language in order for them to practice. So applying the new knowledge and skills and the healthcare settings and enhancing their adaptability in the area they are assigned with were crucial parts of the integration into their clinical workspace. Cultural adaptation and integration were the topmost issues that were encountered by the nurses. adjusting to the dynamics of the workplace. As we mentioned earlier, the hierarchy in the Philippines is quite different in how the hierarchy or the work setting is in most Western and of course North American countries, where the nurses are given the chance and the opportunity to speak up and of course to decide for the patient if merited. Experiencing culture shock in terms of the workplace culture and in environment culture were very much very similar to everyone, even those that are placed in English-speaking countries. The facing discrimination challenges were foremost experienced by most of the nurses, especially in the beginning times of their transition and the first few months of their transition, where they are given less prestigious work or they are discriminated in terms of being talked down during meetings or telling them that their credentials and their backgrounds are not sufficient enough to be merited as a RN or a registered nurse in the country. And a big sense of impact or the impact on the sense of belonging, where the nurses felt that they are living a dual life, which is a professional and a less interaction with the community, or the isolation from the community can become very tedious and can become very stressful in their part, because after work they don't have anybody to talk to and then don't have the community. This is very true among nurses that are placed in diverse settings, those that are placed in countryside such as those in Germany, Finland, and some parts of the United States. To fully understand the impact of Filipino nurse migration, we know all and very well how important the nurses or the Filipino nurses in the worldwide healthcare system. So although that is true, still these complexities are not addressed and there's no support for this particular opportunity, this particular instances by which the nurses encounter, and it becomes very stressful of them. So acknowledging the complexities of vital developing effective policies to support framework are quite important in mitigating these particular scenarios or these experiences. These are the policy recommendations that we have drawn out from the study. Number one, enhancing cultural competency training. So although some of the agencies in the Philippines have started to do a acculturation program, I think most agencies, those that are deploying in Western countries, have already adapted this. Majority of the catchment placement countries has not fully integrated this. So what do you mean by cultural competency training? This is something not limited to language education. This is something that helps the nurses once they reach the country of placement to be able to be assisted and to be guided step by step on how they can integrate with the community. This is as simple as orienting the nurse about the basic facilities of the community, or orienting the nurse or the Filipino nurse on the nearest Asian grocery store, for example, or introducing them to existing Filipino communities or something related to that, or church community or some sort. This is something very helpful on the part of the nurse, especially most nurses at the initial deployment are alone. They are not coming together with their families. Create mentorship opportunities. So establish mentorship programs that pair experienced local nurses with migrant nurses. This is very evident in most of the countries, but some of the nurses said that this is not sufficient to just simply be mentored, because most of them would be guided in the process, but there's no established guidelines, such as those that are placed in the Middle East, for example. They are paired with a local Saudi or Omani nurse, for example, but that Omani and Saudi nurse doesn't really know what is the step-by-step process and how to properly mentor and coach somebody coming from outside. So this is quite important in the mentorship. Another important and peculiar, of course, during the interview is that most of the nurses I interviewed, they said that they don't want to be paired with a Filipino experienced nurse. Doesn't apply to all the experiences, but the nurses that I've interviewed, they said it's better to be paired with nurses from other ethnicity for some reason. So although we are very matulungin in terms of our values as Filipinos, we still have the so-called crab mentality in that particular aspect. This is a part of the verbalization of the nurses. So we don't actually discredit the senior nurses, Filipino nurses. Not all of them are like that, but based on our study findings, most nurses feel the same with their mentors. Streamlining credential recognition, whereas our education system is highly regarded for its content and, of course, the rigorousness of our nursing education system. But the problem is the alignment and the smooth pathway to recognition is not very much anticipated during by the time that the nurses are deployed abroad. The differences in terms of the curricula must be updated. It's not that we should align entirely our curriculum, because of course this is based on the Philippine healthcare system, but we have to face the reality and the fact that our nurses faces difficulty in terms of credentialing and recognition in other countries. Owing to that, our licensure examination, the Philippine nurses licensure examination is totally deviated from how the licensure examination, such as the NCLEX, is given. So this is a clamor for the Philippine nursing authorities, those that are in charge with education, licensure, and so on, to look into updating our licensure processes to be not similar but aligned to be able to recognize the licenses of our nurses directly without them undergoing the difficulties that our respondents did. And of course, provision of psychosocial support among nurses upon, before, and during the process of deployment is essential. Isolation, sadness is a very common experience among migrant nurses. I'm a migrant nurse also, and I've experienced this in my first few months being deployed in the first country where I work with. And this is quite challenging, especially if the support system is not available. So providing psychosocial support through integration and through acculturation is a must among the nurses. So in conclusion, migrating or migrant nurses entails profound emotional, professional, cultural shift, and changes in this magnitude cannot be described as technical linguistic adaptation. So instead, the identity and belonging and meaning shifts must underpin the change. If culturally competent strategies are developed and effective integration mechanisms are implemented, Filipino nurses can be utilized more effectively to contribute to enhance the worldwide healthcare system. So while there are technical and caregiving competencies are often exceptional, and strengths are frequently obscured by systemic linguistic cultural barriers in host countries, they remain committed professionals navigating adversities with grace and grit. The nurses adapt to reshape the global healthcare landscape with their values, skills, and humility. However, the journeys highlight pressing need for more inclusive system to recognize credentials, support language acquisition, and provide and foster a culturally competent work environment. So this ends my presentation. Thank you so much for listening. If you have questions, I would be happy to answer them. These are my selected references. Thank you so much.
Thank you so much, Dr. Valdez. We do have many questions, actually.
Sure.
Okay, so maybe we can answer some that people are flooding the chat with different questions.
Let me.
Would you like to look at them yourself, or would you like me to read them out to you?
Can you help me, Samantha? Sorry.
Yes, no worries. Okay, so we have a Meryl who has asked, what positive outcomes can result from these transitions?
Well, positive outcomes with the transition is the result of the study actually tells us about the most would be the challenges, but also the opportunities to improve them. So positive outcomes would mean that this particular study, the one that I just finished, would be published soon under Frontiers in Nursing. And I'm trying to echo the results of this through this platform, which is I'm very thankful for. And I will be presenting this in the Transcultural Conference in the US later on, soon at the end of the year. And this might result into something positive if the leaders in the Philippines and, of course, the catchment countries can look upon this particular challenges that nurses experience to build on the projects or build on similar transition programs and cultural programs in specific countries or areas. Like for me, I'm based here in the KSA, so I'm strongly advocating for a cultural transition for nurses that are deployed here in this country.
Thank you so much. We have several questions around the cultural differences. So, for example, how can culturally competent strategies help Filipino migrant nurses integrate more effectively into foreign healthcare systems? And we also have, related to this question, as a nurse planning to work abroad, how would you handle cultural differences in patient care practices?
Yes, thank you so much, Samantha. So in that premise, as I mentioned, some of the agencies, deploying agencies, not all of them, actually have a pre-acculturation programs and post-acculturation programs. So that is well and good. If it is built in the system, then that is an advantage on your part. But most of them don't have this acculturation program. So what can you do? So in my personal view, we have to research and to personally train ourselves in order to prepare ourselves with the situation. Knowing somebody from that country can also help by asking them how it is to transition there. If there's somebody there who went before you, like for example, like if you're deployed in the United States and you were deployed somewhere very far from the main cities. So usually there's one or two nurses that are there. It's good to communicate. So social media is also a very important platform where you can connect with these people and try to learn, of course, about the culture, the expectations, and all this from them firsthand. And of course, we have the ability to pull the information from different sources. Let's prepare ourselves before that. So this helps us a little bit, not too much of that. So as I said, the agencies, the government agencies, the agencies deploying the nurses are mainly responsible for this.
Thank you for that reply.
Thank
We
you.
now have a very interesting question, which is how can psychosocial support systems such as counseling and peer support groups be tailored to address unique emotional challenges faced by Filipino migrant nurses during their transition abroad?
Well, this is a crucial part of the integration because the main serious issue that is experienced by nurses would be isolation in the first few months of transition. Most nurses gets over that. So as Filipinos, we're very resilient, but not all are capable of actually recovering from that isolation period or that stage where they feel that they're alone and they don't have a support. So the important thing here is that to have the psychosocial support that is professional. It can be, as I mentioned, be integrated as a part of the program of the agencies and the deploying agencies post-deployment, not only pre-deployment, but post-deployment, because most of this experiences only happens when they're already in the country where they are situated, not before they are deployed. So it's immense that important that the agencies, the deploying agencies, the catchment agencies, or if the contract is from government to government, like in some cases, like in Germany, it is a government coordination between the deployment of nurses, then it's important for the both governments to act on and providing the acculturation programs, coupled, of course, with psychosocial programs, language training, and all these things that are relevant for them to transition smoothly in the places where they are deployed.
Thank you so much. We do have a lot of questions about if you have any specific strategies or coping mechanisms that successful migrant Filipino nurses use to overcome cultural and educational barriers abroad, or how to build resilience and cope with stress during this transition period.
Okay. So, specific personal, in my personal point of view, it's important to seek out for people whom you can communicate with. It's easy to do things to divert your attention, but these types of activities will divert your attention momentarily. It's important to get in touch or be linked with a community group. So that doesn't work with everyone, but this is an important part of the transition process. At least on the first 6 months or the first years of your transition, try to be involved with a group of communities. It can be Filipinos if there's no available Filipino community in your area. It's important to get connected, whether if it is through the church or a certain hobby. Like on my part, I play bowling, so I met some friends during a bowling tournament, so I try to involve myself. This takes away that burden of being alone and stressed. In terms of cultural adaptability, it really depends on how prepared you are. So some environment really pushes you to adapt into the environment by force. Like being here in the Middle East, they will not train you how to speak Arabic. They will immediately put you on the ward, which allows you to communicate and be trained in speaking with the patient. And that is on your own side. So this is something that you have to prepare on your own. So techniques can vary depending on your individual requirements or what it is that you're interested with, and try to go for something that you are interested with and things that you feel will relieve that sense of isolation and all this emotional burden. So communicating with people is an important part of that. And if it is, I told you, if it is built within the system of the program of the agencies you are working with, then well and good. If not, really, you have to do it on your own to be able to survive those transition days or months.
Thank you so much. I'm just going through the questions, and most people have the same sort of worries about adapting to these cultural differences and how they can make sure to cope with the stress and all the pressure. So the people are also asking, what advice would you give Filipino nursing students or professionals who aspire to work abroad, if you give them any advice before taking that step?
Thank you, Samantha. So my advice for aspiring students, so of course, all of us dreams of moving somewhere outside the Philippines because of the various conditions that I've already mentioned earlier. One of them, of course, would be financial stability, and of course, some of them would be familial responsibilities. So just make sure that you are well prepared in terms of emotionally, spiritually, physically, when you decide to move abroad. Because to move somewhere you are not familiar with is not for the faint heart. So you have to be brave enough to look into scenarios that you will be sometimes alone. You have to eat alone, you have to go out alone, and you don't have friends at the initial stage where you will be transitioned. And you prepare yourself ahead of time about these expectations and to know where help can be taken, or what help can be available for you. So my advice is that for you to know whether there is a Filipino organization in the area, there's Google Maps, there's the internet. You can search for the closest church if you are a Catholic or whatever religion you have, which these are the main things that we have to get acquainted with in order to feel at least a little bit closer to home. So we have Filipino organization. What are the hobbies that you have? Like for example, if I play bowling or tennis, this is a personal advice. I look for where is the closest bowling alley or tennis court in the area, a tennis organization or bowling organization. So this prepares you ahead of time to realize and to project yourself into how to settle in that environment. Of course, that will not be 100% true when you are already in the place where you're deployed because we have the situation, the difference in the situation when you are already in the actual experience, when you are already alone and you're put into a house or a housing facility alone. So this can really mess up your psyche or your psychology. But preparing and being ready is important part of the transition program. So as I mentioned, if the agency has a program, which I believe some agencies have programs to acculture the person within at least 6 months of their transition, that is well and good. If not, you have to really prepare for your own, meaning you have to research and you have to imbibe that idea that once you are there, you have to fend for yourself and so on.
Thank you. We
Thank
have
you.
another question, which is, what are the common misconceptions or stereotypes the Filipino nurses encounter in their workspaces, and how can these be addressed?
Well, apart from we are good singers, as a stereotype for nurses in the Philippines, which we do sing good. But the stereotype is that we are less qualified than most of them because we have to undergo the transition of educating ourselves, proving that our credentials are really authentic and so on. This can be something a little bit demoralizing on the part of the nurses, I know, in their transition period. But in most parts, we prove them wrong because, as you know, the Filipino nurses are well regarded for their ethics and for how they work. And of course, most likely, maybe 95% of the time, most patients would like to be with a Filipino nurse. But there are a lot of stereotypes, of course. So it can be work-related stereotype and be cultural stereotypes. But in workplaces, in most parts, since this is because it's given that we are foreigners to the country, they often see us as somebody would be with lesser salary or somebody who is lesser qualified and so on, which is not true because some of our nurses are even doctors in the Philippines. But because our system is not really fully aligned with these foreign countries, we have to take a step back in order for us to be recognized.
Thank you for that.
Thank you.
Another important question is, how can Filipino nurses address and report instances of discrimination, microaggressions, and bullying in the workplace? What are the best
Okay.
practices for building resilience in the face of these challenges?
Okay, very good question. So in some countries, and Western countries in particular, there is a reporting form. So I think our colleagues coming from different countries, Western countries, they have the reporting form wherein bullying, discrimination, and so on can be directly reported, and there's a protocol for that. So you don't get scared and be afraid if you see an instance and you felt an instance in your work setting that you felt that you are being discriminated, bullied, or something that is similar to that. It may be physical, psychological, or in whatever form, you have the right to file for the case. And it has a protocol and algorithm that is case to case or case to case basis on how the committee works in the hospital, but there is existing grievance committee at least in most of the hospitals. So I'm talking about the more advanced or the more developed countries, such as those in Western countries, US and in United States and in Europe, for example. In the Middle East here, we have that system, but the system is not that well implemented. It appears or it is present in big magnet hospitals and big tertiary hospitals, But those that are in the ministry government, they might have some difficulties in that. So that is the case here in the Middle East.
Perfect. We have another question, which is if you don't have access to real life connections with nurses who are abroad, can we rely on trustworthy and reliable online resources instead? For example, can we use platforms like Google or YouTube, or is it always better to gain real-time experiences?
Well, that can be a good additional source, but you know that social media platforms usually show you the good side, so the good side of everything. So maybe very few people will show the bad side of what the experience is. But it will help because you get acculturated with the location, the scenes, on how the day-to-day life is done in that particular place or particular part of the world. But in order for you to prepare yourself, you try to read on, for example, researches, such as this research that I've just finished, can be a valuable resource and input because it is factual. And of course, if you don't have any direct relations to anybody there in the country, then maybe you can talk to somebody from other countries also that may have been deployed in that country. The experience may not be similar, but at least you know exactly what their emotions and feelings during that transition period was, and that can something that can provide you with a little idea of how it is to be there. Or since the social media platform is available, there are a lot of groups, and you can join those groups to interact with real life individuals and their experiences and so on.
Perfect. Now, we have a person who's asking about if it's a requirement to learn the language, to be fluent in the language, or is basic language enough?
We're, of course, in countries, as I mentioned earlier, in Germany, the B2 language is the parameter. But when you are already in the clinical practice, this is a lay conversation, a day-to-day conversation. So fluency comes after some years of experience, of course, because the difficulty among the second language learners, those in the European countries where English is not the first language, or here in the Middle East, would be to learn about the everyday language, which is the lay language, and the technical language, which is the medical language in the language that they are using. So this is can be a bit challenging. Fluency, of course, they don't expect you to be outright 100% fluent, but they expect you to develop the language to a point where you can converse freely with the patient. And I mean, at least to be fluent with the language after some time. Usually it takes years for people to become really fluent. And it is given to them through trainings, of course, and they are forced really to go to the bedside and talk to the patient. So at first, when you arrive to the country, they don't expect you to be fluent, of course. It's different when you learn it in textbook and or in your classroom when you do the language courses than when you are in the bedside and practicing the language with the patient and talking on a daily basis. So that's it. So learn the language at the level which is expected from you by your agency or the country catchment, and then you will be able to develop them later on.
Perfect. Now, a follow-up on that question is, since many nurses are now working in different countries, do you think schools might start offering subject on foreign languages to help prepare for that?
Yes, actually, that I think there's some schools that already have been experienced or there have been offering languages based on the country tie-up that they have. So I think there's a university in Manila where they offer languages in German, and some are offering languages in Arabic. So this can be a what do you call this elective course for the nurses to take whether if they are going to pursue a work abroad. Of course, English is technically very important because this is something that is universal for everyone in every country, I mean. But of course, having an advantage of getting the language that is required in your placement countries or the country or prospective countries that you want to work with would also be very advantageous on the part of the nurses.
Perfect. Thank you so much.
Thank you.
Okay, so we have this question, which is, how can transnational nursing education be implemented in the Philippines without undermining local nursing traditions and practices?
Yes, so this is a part of the recommendation actually to not fully adopt, but at least look into how the education system, the curricular system, even the licensing procedure in the Philippines is implemented. It need not to be a total copy of those curriculums, but at least create a pathway for a smoother transition or recognition and evaluation for the nurses. A good example of this would be our Philippine nurses licensure examination. If you look at how the testing format of our nursing licensure in the Philippines, this is basically aligned, of course, with the curriculum that is given to our students. But looking at further, if we could introduce something similar to a CAT-based or a computer-assisted testing like the NCLEX, it might not contain the same NCLEX format, but in Philippine setting format, it will allow the nurses to be more familiar with computer-based testing. So that can be an avenue. Or if we can do the same NCLEX format and we can actually integrate and create a sort of um, understanding with the countries, placement countries, like the US, Australia, or other countries, to recognize our testing system to be valid and to be reliable, then there is no need for us to take the NCLEX as a separate exam after passing the licensure exam in the Philippines. So this is just something that we have to look into in the future because still the Philippine licensure examination is paper-based and there should be some improvement to that, not only in content but also in making the reality, making it aligned with the reality that no most of our nurses, if not all the nurses, would aspire to work somewhere else in the future. So curriculum-wise, there are a lot of talks about aligning the curricular offerings. They said that our system is US based, which is true. We use US textbooks and everything. Even the manner of teaching our students is more rigorous compared to other countries. But the question is it able to make the life of our nurses easier for them to transition when they are placed somewhere outside the Philippines?
Wonderful. Thank you. We seem to, and I know you answered this before, but there are still great concerns from people who are writing in the chat and in the questions around about coping mechanisms when they're away. Like, how do they cope with the experience? Sorry, the chat's moving. Health or health care workers in abroad, how do they implement respect to their nurses based on the country where they came from? So there's a lot of worry about how they can cope away from home, away from their family. I know you mentioned your different hobbies and such, but if you wouldn't mind repeating it, because there is a lot of people who are still very focused on this worry, on adapting to the cultural differences and so on.
Yes, thank you, Samantha. Yes, I've actually mentioned this earlier, but I think this is something that most people are curious about. And of course, this is part of our anxiety when we decide to go outside and work somewhere else and be positioned somewhere we are not familiar. That is very common. So support groups is an important part of the transition process whether if it is prior to your deployment or when you arrive, it's important that support is evident. Most agencies will have, in some agencies, I know that they have this acculturation programs with their nurses, at least for the first 6 months when they are trained how to be mobile in the community where they're placed. They are partnered with somebody who is local to train them where is the closest Asian grocery store, for example, or the closest church, or if there's a Filipino organization, they try to introduce you with the Filipino community, and that can be very helpful if it is present. If not, of course, you have to really prepare yourself. In my personal perspective, as a migrant nurse myself, I expected that I will not have somebody at the other end of the world to, of course, welcome me. So what I did is I did a lot of research about the countries, of course, the pros and cons of being there, how I will be able to navigate through the cultural differences. I have to research for things that must be done, and things that I should not violate in terms of being culturally appropriate, for example, like dressing and all these things. Language is something you have to learn, the basic things of how to communicate. The funny thing is that when I move abroad, is that the main thing that I memorize is how to give the directions so that I know how to get back home and how to say the usual greetings. So this basic things that prepares you before the deployment gives a lot of difference when you are there. So you come prepared, you research, you identify the things that are expected in that community. If there's a possibility of communicating with someone who is a Filipino, for example, who went ahead of you in that particular area, that will help a lot because there's a sense that if I go there, I know that I will not be alone. Another important reminder for nurses who will be deployed is to look for government Philippine agencies such as consular or embassies, their numbers, their emails. You have to prepare that because you don't know what to expect when you get there. And of course, if you have relatives on that particular countries, it's important to get in contact and in touch with them. So these are just some of the preparations that you can do in order to prepare yourself in moving abroad. Of course, this can be an individual basis, a case-to-case basis. Looking for something that you would be um, busy about, such as the things that you enjoy doing the most. As I mentioned earlier, the first thing I search is a bowling alley closest to the town or the city where I'm placed, or a tennis court, for example. And then slowly move on to that in order to have at least an outlet when you are already in the catchment or the placement area. So these are just personal advices. This depends on you as an individual. How is your coping mechanism? Because we have unique coping mechanisms, and we should go with how we cope with stress.
Thank you so much. So, changing the topic a little bit, we have a question which is, what are some positive outcomes that can result from these transitions?
Where positive outcomes with the transition is you become a strong person afterwards. So I didn't think that I'll survive the Middle East. This is my third country, and I've been in the Middle East for 15 years, but I didn't think that I will be able to thrive here as a professional, as a professor, and so on. So you'll be surprised how long you can go when you are already transitioned into the system. Most of the nurses, Filipino nurses, after transitioning into their countries, become very successful in their endeavors, where they're able to build their communities, progress, and become community leaders, of course, and become professionals and to go further for the education. So these are things that are expected with that. But mainly, that ease that you are already a part of the community is rewarding after the transition period.
Perfect. Thank you so much. I think that's all the time we have for today. And also people are still asking mostly the same questions, but I think you've done a very good job in answering all of them.
Thank you.
Perfect. So before we do our final remarks, is there anything else that you would like to add?
Thank you so much, Samantha, and of course, thank you so much to the Filipino Nursing Diaspora Network and the other sponsors for allowing us to use this platform to share with you this information, because this is a crucial topic that needs to be shared, especially for our new nurses that are still in the BSN program, and those nurses that are maybe employed somewhere else in other parts of the world who plans to transition somewhere else. So this is to encourage and both for you to be prepared with your dreams and of course the expectations that are based on reality. So thank you so much for this opportunity to share this study inputs and findings. Thank you so much.
Thank you so much, Dr. Glenn. It was an amazing presentation, very insightful. And thank you so much for answering all of the questions. Now, before we continue, I would like to share the following message. So I'd like to share the following message from Dr. Patria Manalasese, President of the Pacific Nursing Service Organization. Just give me one moment, please.
Good day to all, and thank you for being part of this truly enriching webinar. On behalf of the Pacific Nursing Service Organization, I extend my heartfelt gratitude to Dr. Glenn Ford Valdez for sharing his expertise and perspectives from the Kingdom of Saudi Arabia. His insights today have helped us reflect deeply on the unique experiences, challenges, and leadership potential of nurses in diverse cultural and regional contexts. This event is a testament to what we can achieve when we bring our voices together across borders. At PNSO, we remain deeply committed to advancing dialogue, research, and action that center the voices of our migrant and multicultural nurses. I would also like to sincerely thank our valued partners, St. Anthony's College, the Filipino Nursing Diaspora Network, and the World Continuing Education Alliance for making this meaningful exchange possible. May this conversation not end here. Let it spark deeper collaborations and inspire us all to be better advocates, partners, and leaders in shaping the future of nursing, locally and globally. Maraming salamat and mabuhay tayong lahat.
Wonderful. Thank you everyone for joining today. Thank you, Dr. Glenn, as well for the presentation. Thank you, Ma'am Irene, for your wonderful words at the beginning of the presentation. And also thank you, Aris, for joining in the session as well.